morning, Johnny's on.
Hi, Johnny. Good morning.
Good morning, everyone. Thank you so much for joining us today. I still see a couple more participants joining, so we'll give us just a couple more minutes before we get started. If in the meantime, you can take a moment and mute your phones if you haven't done so already, we'll make sure there's plenty of opportunities for you to ask questions throughout the presentation. Again, we'll get started here in just a few minutes as I see some more participants joining. Okay, to respect everyone's time, I think we can go ahead and get started. Again, welcome and good morning. Thank you so much for joining us today. My name is Johnny Christensen. I'm the Director of Provider Network with Arizona Care Network. And I am so excited to introduce the alignment team and excited for the partnership that we have going into 2022. So Miriam, if you want to go to the agenda, I can do an overview and introduction and hand it over to you all. So we've got some of the key leadership with alignment on the call with us today. We've got Dan Peterson, he's going to do an overview of alignment and a little bit of history of the organization. We've got Jeff Chakotz, he's going to do an overview of what your patients are going to be able to access through their benefits. We've got Dr. Michael Kodiansky. He's going to talk a little bit about the clinical model and what to anticipate for your patients as they select this plan. And then we have Miriam Molina. She's going to talk about the network operations and kind of some of the key information that you're going to need as providers in this plan. So I'll go ahead and hand it over to Dan. Again, thank you so much for joining us, and look forward to hearing all of this great stuff Alignment's going to bring.
All right. Thank you, Johnny. And thank you, everybody, for making time this morning, this beautiful Arizona morning. I know we all have busy days ahead of us, so we'll get right to the point with our presentation here. We're really excited to be partnered with ACN in both Maricopa and Pima County. Just a great organization. We're thrilled to come into Arizona with this key partnership of ours. Our company is hiring a lot of us Arizonans to be boots on the ground. So this won't be the first time you'll hear or see from us, and we want to just make sure you know you can reach out to us at any point, at any time. We want to make this work well for everybody. Dr. Kodiansky and I have spent a large part of our careers on the provider side, so we know intimately what it takes to be a good payer partner in this part of healthcare, and we really want to make this work. I want to talk about some highlights related to alignment before Jeff gets into details on the benefits. We're new to Arizona. This is an expansion effort on our part, but we're not new to Medicare Advantage. We acquired a health plan in California back in 2014 and have done really, really well. We have really significant growth year over year, really high star quality ratings, great provider engagement, really good member retention. So we just want to reiterate that we are not new to this part of healthcare. Medicare Advantage is our forte, and we've excelled at it for a number of years, which makes us really excited about coming into Arizona. Just a few highlights on this slide here. Up in the upper left, you'll see that we've won the Senior Choice Gold Award for Excellence in Medicare Benefits this year. So Jeff will dive into what that means in particular. Up in the right, you'll see that the U.S. News and World Report named us one of the 5 best Medicare plans in California. And that's a lofty achievement because California has 55 different Medicare plans. So we're in the top 10 throughout all of California. On the lower left, you'll see that we went public in March of 2021. So we're very well capitalized. We have a lot of cash now, which allows us to come into states like Arizona very effectively, very stable financially. Lower right is another award that we won related to our pharmacy efforts. We're brand new in Arizona, so we don't have a star to report here, but we've done very well in our home state. We are 5-star rated plan on the Part D, the pharmacy efforts, and 4-star overall on the A and B combination. This slide here speaks to some of these points. I just mentioned the star performance. We have a 90% ranking in the CMS Medicare and U process. The center circle talks about how we're built on service. And we put this in here just to reiterate that we want to do well by our members, your patients, and by you, our provider partners. Our CEO led off an all-company meeting recently by saying we need to approach our work by having a servant heart. And I know it sounds cliche because a lot of healthcare companies talk about putting the patient first or putting our provider partnership first, but we really believe in that. We really try to do that day in and day out. The next circle there, you'll see we're a $1 billion company in terms of top line revenue. And then I mentioned our public offering, which has given us a lot of capital to do the things we want to do with our expansion efforts. We now have over 800 employees in 4 different states. So out of California, we've now expanded into Nevada, North Carolina, and this year, Arizona. On the lower left, you'll see our net promoter score, and this is double the industry average. So alignment members talk about us favorably, they refer their family and friends, and that's helped with our really strong growth rates and retention rates over the years. We have now over 85,000 members in the 4 different states and a 36% cumulative annual growth rate. So we grow at a really good clip because of our benefit design, because we partner with entities like ACN, because we excel at service, and we're really excited to do all this in Arizona. The next circle there just talks about the different markets we're in the 4 states and the different products that we have. We have 3 exciting products that Jeff will get into for Arizona. Really excited about that. And then the lower right shows one of our key clinical statistics. We do a really good job at keeping people healthy and avoiding unnecessary hospitalizations. It's one of our main reasons why we can keep our benefits the way they are. And Dr. Kadansky will speak on how our clinical leaders are very involved with designing our benefits to help the members achieve optimal health. One thing I wanted to point out related to this bubble here, we have a broker that's #1 in Arizona. So we're in our annual enrollment period. We're tracking all of our broker relationships, and she is selling a lot of alignment. So we asked her what her secret sauce was, and she shared that she moved to Arizona recently from California. And over the years in California, she sold a ton of alignment as well. And there are 2 main reasons, she says. One, alignment's consistent year over year. So we design our benefits. A lot of people, a lot of plans worry that a new plan like ours is going to come in and lowball and buy up the business and then change. But in her experience, she shared, we don't do that. We're consistent year over year. And then she also reports that there are very few member issues. So as a broker, she has that client relationship. She doesn't want to get in the middle of all kinds of issues. And she says alignment really excels at doing good service and keeping the members very happy. So again, great to be with you today. I'm very proud that our company is investing in a lot of us Arizonans. A lot of our competitors will try to manage from California or manage from Minnesota. We are investing in Arizona, putting a lot of us in the market to help you and help our members succeed. So thank you very much, and I look forward to working with you all. And here's Jeff.
Hey, Dan. Good morning, everybody. We got the early risers this morning. Thank you for taking the time to spend a few minutes with us. My name is Jeff Chakotz. I'm the Regional Director of Sales. I'm right here in Phoenix, Arizona. I've actually been in the Arizona market since 2005 with a couple of organizations. But when I got the opportunity to join Alignment here in June, I was really excited about joining them. I've competed against them in other markets with other plans. I know their capabilities, and I know the great benefits and service that they bring to their members. Dan mentioned service. You know, before I touch on benefits, I want to talk a little bit about how we treat our members as VIPs, and that's how we really consider our members on our plan. Every single member, when they enroll in Alignment, receive an Access on Demand concierge card. This gives them 24/7, 24 hours a day, 7 days a week, access to our concierge team. And in a slide after this, I'll show you kind of how it's broken out, but it really helps members navigate services, benefits. They even have access to a board certified doctor anytime, day or night. It's like having a doctor in the family, to be very honest with you. And this is a one-of-a-kind card. We only have one card. A lot of our competitors have tried to copy this over time, but we really have committed this to deliver VIP concierge care to our members without the VIP costs. This card also acts as a debit card. And on this debit card, which I'll show you, we load our over-the-counter benefit, our grocery benefit, our health and wellness benefits. So it's really important that the member takes care of this card like they would a normal debit card. We're even going to brand it a MasterCard this year. We found that while vendors may not know alignment, they know MasterCard. And so that helps it with the acceptance on this card. You can see at the top through our 24/7 concierge that they can arrange transportation, gym access, pet services. Yes, some of our plans have pet services, and I'll talk about that in a minute. Dental, personal emergency response, virtual care, vision, pest control. Yes, pest control too. Hearing aids, and even companion care. And you can see on the bottom that the debit side of the card works with over-the-counter that gets loaded automatically every month. And for the plans that have grocery benefits, that gets loaded automatically every month. There's nothing the member needs to do. It's really their one-stop connection to the health plan, 24 hours a day, 7 days a week. We're very proud of this and of offering this to our members for the VIP care that they deserve. Talk a little bit about our pharmacy on our plans. We don't have a standard or preferred. All of our pharmacy vendors are preferred from a contractual basis. Costco, CVS, Walgreens, as you can see. Walgreens and Costco is our mail order pharmacy. We even have access to the online pharmacy formulary on our Alignment Health Plan website that members, anybody can access. I will say we have a 6-tier pharmacy this year. The 6th tier has over 160 of the most common brand name drugs to treat diabetes, high blood pressure, and cholesterol, 100-day supply at a zero copay. This pharmacy formulary and the way we've designed it, as Dan mentioned, helps us achieve the 5-star rating on our pharmacy plans. Let's talk a little bit about benefits. You know, before I walk through these in a second here, I will tell you, I get a lot of comments from the brokers and the agents that represent our plan and out in the marketplace. We haven't seen benefits like this in a long, long time in Arizona. And it's really the commitment that Alignment has made to delivering not only high quality healthcare that Dr. Kadansky will talk about in a minute on our model of care, but also the benefits that helps allow them to access healthcare that they may not normally have the opportunity to do so. This is our HMO plan in both Maricopa and Pima counties, zero premium. Maximum out-of-pocket of $2,499, which is the lowest in either market. Inpatient hospital, $100 per day, days 1 through 3. Typical HMO plans in this market have $175, $185, up to $195, and even higher, days 1 through 7. We found this to be a barrier for care for a lot of members. PCP, specialist, lab and x-ray, zero. Ambulance, you can see dental benefits is embedded in these plans, $1,500 benefit. There's an option to buy up if they choose to get a more comprehensive and bigger benefit on their dental. Vision, hearing, over the counter, $25 every month. Remember, I said it's loaded onto the black card, the access card, so that at the end of every month, it doesn't roll over. But this gets loaded, the member doesn't need to do anything, and the benefit like that just gets access for the member every single month. One thing I want to do mention about our HMO plans that have attracted a ton of attention, as you can see, these are market-leading benefits in both counties, is that number one, the number one, we have branded it as the one or El Único in some of our markets where we're branding it with our Hispanic population. Also, Alignment was just named one of 16 Medicare plans nationally to be recognized for cost sharing effectiveness in the design of our 2022 medical and Part D prescription drug benefit plans. There's an organization called Health Metrics Research. You can go to MedicareNewsWatch.com to check this out. But they compared all the plans in Maricopa and Pima County. There's only one plan that qualified for the cost share award recognition, and that was Alignment Health Plan. It's our commitment to delivering high quality care at an affordable price to our members. So we try to eliminate barriers of care everywhere we can. And you'll say, well, how can you offer benefits like this? You know, Dr. Kadansky is going to talk about our model of care, and Dan mentioned it in our ability to operate underneath the Medicare threshold that allows us to offer benefits like this. And if you look at our California markets year over year, we have consistently, as Dan mentioned, our top broker, we're very consistent in the benefits that we offer. And we believe the model of care and the care that we give our members allows us to do this. So that's the HMO plan. And next slide, if we go over to, I believe, the PPO offering here in Maricopa and Pima County. There we go. Well, let's go to the chronic SNP plan first. We have all, by the way, we have all three offerings. We have HMO in Maricopa and Pima, PPO in Maricopa and Pima, and then our heart and diabetic chronic SNP plan. Again, if you look at the premium, a zero premium, maximum out of pocket of $2,499, which is market leading. Inpatient hospital acute, zero. PCP, specialist, lab and x-ray, zero. You can see diabetic supplies, dialysis services, embedded dental, vision, hearing. This has a $40 a month over-the-counter benefit. This plan also includes our personal emergency response offering to members who join this plan. Again, this is a market leader. We're seeing tremendous interest in enrollment in this plan already during this AEP season. For those of you who keep track of it, we go till December 7th on our AEP. So we're really excited about our heart and diabetic plan. And there's our PPO plan. Both Maricopa and Pima County, they're the same plan. $3,900 in network, maximum out of pocket, $6,500 combined out. For those of you who've done any comparison of PPO plans, this is market leading. Nobody has maximum out of pockets as low as we do for in and out of network services. Inpatient hospital, $150 a day, 1 through 3 in, and 30% out. Even our out-of-network benefit beats most PPO plans with the 40 and 50% co-insurance that they offer. One note I want to make here on our PCP and specialist visit. Now, this is a PPO that is, standard PPO. So when they visit, they come to the offices and for PCP at $5 and specialists at $20. We also offer on this plan because we saw, because of the pandemic, a lot of members utilizing telemedicine, virtual care. So you can see at the top there, it's called AVA. And Dr. Kadansky is going to talk about the AVA model, which stands for Alignment Virtual Application. And it is really the foundation of our entire health plan. But when they choose to use a PCP or specialist on a virtual basis, those copays are zero. So it's really a very strong PPO plan just by itself. It also lends itself to our tech savvy members who are aging into Medicare and are not afraid to use their technical device to access care. And we think this is going to be something that's with us and it's going to stay. So we've built this into our PPO product here in Maricopa and Pima County. This plan also has dental, vision, and hearing. There is an option buy-up. It has 500 embedded on preventative, but it also allows them to go to 2,000 and enhanced vision and hearing benefits and the personal emergency response. So a lot of detail behind on this plan, but a very strong plan nonetheless. All three plans. Supplemental benefits. I'll just spend a minute talking on these. I mentioned that, they're designed, while they're not designed per se to impact health by itself. It's the quality of life that these benefits lend themselves to. So pet care. Well, why would we offer pet care? Well, we found members. Well, we all know, for those of us who are pet lovers, our pets are part of our family. And we found members missing appointments or procedures or even leaving the hospital early, because they want to care for their pets. So we offered pet care so that we could improve the quality of the care that we deliver to our members. Pest control. We have found many members that need that assistance because of a health and safety issue. So we offer that once a year as well for members that qualify for it. Acupuncture and chiropractic services, over-the-counter grocery benefit. We found that about 9% of our members don't have enough money left over at the end of the month to buy groceries. So on our HMO plans, we have a $10 a month for Maricopa County, $20 a month for Pima County. And again, this just gets loaded automatically onto their access card. Even companion care, we found that, without even the pandemic, that people, Medicare beneficiaries have a feeling of loneliness and isolation. Well, we want to help them with that. And so this is non-medical services. It's for general companionship, daily chores, or just sitting and talking with a member as well. So, it's included with many of our plans. I won't go into the details this morning. This is what a CMS has allowed us to add as supplemental benefits onto our plan. And while our core benefits are super strong, best in the market, adding these just helps improve the quality of life of each and every one of our members. All right, I'm going to turn it over to Dr. Kadansky to talk about our clinical programs and our model of care.
Hi, everyone, and welcome today. I'm Mike Kadansky, Regional Medical Officer, or basically your Clinical Medical Director for Alignment here in Arizona. Just want to take a few minutes and put a few highlights on our clinical programs and just explain a little bit more about who we are. And certainly if questions come up, you can ask me not only afterwards, but directly call me by my cell phone, email, or whatever means necessary. I just wanted to piggyback on top of what Jeff was saying, and that our clinical team, myself included, are actively involved as we sit down and try to put together the best benefit package for our members and patients in each year. And a lot of thought goes into this around problems or barriers we've seen to care as clinicians, and trying to put into place the best benefits to address these. And that's where you see these super low copays or costs of care to eliminate any barriers that cost provides to accessing the care that patients need, as well as our more unusual supplemental benefits. A lot of that comes from things we've seen in the past, whether it's patients with food scarcity, patients with a bed bug infestation, patients that have had other issues where they need pet care because they're hospitalized and they're not wanting to stay in the hospital as a result. I mean, there's lots of examples of where there are barriers or challenges to care, and we're trying to address those the best that we can. And certainly our benefits are market leading. When it comes to cost for patients, I have not seen a plan that provides all that we provide. I also wanted to take a few minutes to talk just a bit about our clinical programs. When it comes to alignment and the quality care that's provided, obviously it starts with all of you, our primary care physicians and specialists that are part of our network. And what we try to do is build on that and provide support, often for the highest risk, sickest of the sick patients, ones that have been hospitalized, and patients that may not even be able to make it into the office because they're so sick for a period of time. So some of the things that we offer include our Care Anywhere program, which is basically a home-based program for patients that are identified as the highest risk in our model of care. And it involves going out and often actively managing patients until they stabilize enough to make it back in to see you. Part of this Care Anywhere program also includes a Healthy at Home program. So for patients that have been hospitalized, we usually make a minimum of one home visit when patients are discharged, so we can coordinate their care and really know what's going on and get them back to you. There are other pieces of care that are also involved. We've got a very robust case management system with social work support included. We also have what's called the virtual care centers. So especially for patients after hours that have clinical needs and would otherwise go to the ER, they have ability through our 24/7 concierge line to access a doc on call and to actually have urgent needs met if they're not able to get into the next day or at the end of the weekend. So certainly we try to support patients in that way as well. Some of our other programs include a chronic kidney disease program. So patients with more advanced CKD 4 or 5, we tend to grab on and help manage them for two reasons. One, to try to prevent progression to dialysis stage, but also if they are heading in that direction, to really work to get them a fistula and to have planning done in advance so it doesn't turn into an emergent case in the hospital and more headache as they need to start dialysis on a more emergent basis. And then finally, the other thing that we offer is our Jumpstart assessment, which is basically the equivalent of what you do in the office as a wellness visit, but often we will do that in the home setting if patients are not able to be reached or come in. And certainly if we're already visiting them in the home anyway, we'll get involved and support where we need to if they haven't had that service provided already. You go to the next slide. The other piece I wanted to touch on is AVA, which is basically our larger technology platform and something that we'll roll out to you in the coming months. I think you have to see it to fully understand, but it's basically a little different than the average health plan portal in that there is a ton of medical and clinical information that helps you to provide the highest quality care. And it's all available in a self-service format. So not where you have to ask us to pull a report or get you information as much as you're able to go in and get it. And it's unique in that it basically refreshes about every 15 minutes. So it provides you data in real time. There's basically an ADT feed that comes through so you can know if any of your patients are in the hospital. There's data that provides information about open quality or open chronic disease coding gaps that you're able to see in an easy to use format, and also provides clinical alerts to that effect. In addition to that, there's an artificial intelligence piece that comes with it that allows us to really risk stratify and identify the highest risk patients that may be appropriate for our Care Anywhere program. And that takes into account past hospitalizations, takes into account medications that are on, combinations of chronic conditions, and a whole bunch of other details that get put together for us to help identify the patients that are most in need. Certainly with Care Anywhere as well, as clinicians, you are able to refer in at any time if you feel somebody is particularly high risk or you're having a tough time with overall management just because they're not able to come in or they're super sick. But the platform in general is unique just because of the amount of data that's available at your fingertips when you see the patient. It will tell you everything from medications that have been recently filled, where and what quantity, what specialist patients are seeing, and where they've been across a timeline that really gives you a good idea of patients that have been hospitalized, admitted to SNF or rehab, psych admissions. Everything shows up on an easy grid or timeline so you can see what's happening to patients over time. It's a little bit harder to explain without being able to see it. And unfortunately, until you have patients in our system, there's not much that I can load up and share with you. But I promise for you, as we get to the end of the year and as we start the new year and you have patients, we'll be coming out to offices so we can really demonstrate this in more detail, make sure you all have access, and at the same time, answer questions and show you how to find information, because I think you'll be impressed. It certainly, it kind of blew me away when I first saw it, but as I've now been using it to help care for patients and really identify who needs our help, it's been fantastic so far. And I see a question there that says, is AVA a separate dashboard? Currently, it is a separate system that you can go in to access information. There have been examples where we've built bridges to feed information into EMRs. It really just depends on the EMR system and the amount of patients you have, whether it's worth your while to go through all that effort to have that done, but something that we can talk about offline as well. because certainly there is an application or a use for that in certain circumstances. So I'm going to wrap it up here and hand off to Miriam so she can provide more details on provider education and how you get started with us. But certainly this won't be the last you're seeing of me, and thanks for your time.
Thank you, Dr. Kedensky. Good morning. My name is Miriam Molina. I'm the Director of Network Management. I also want to introduce you to Paola Ospina. She's part of my team. She's a provider engagement specialist. So you might be hearing from either of us to offer additional training, to meet with your staff, either virtually or in person. So I'll be covering a few items today. First of all, Access Express. This is the system that we use to check eligibility, do referrals. You can check claim status in here. So this is something that Paola and I will need to give you access. So please reach out to us. We can definitely set up a training for your staff so that they know how to submit referrals for certain things and how to check eligibility. It's a very easy system to use. Here is a copy of the member ID card. The PPO card looks like this. You'll see the alignment logo in the front. And if it's a member assigned to the PPO plan, you will be able to see PPO up here. You will be able to identify what plan the patient is part of, as well as the medical group name. So if the patient is part of Arizona Care Network, you will see Arizona Care Network under medical group. This is a HMO card as well. The back of that card has important information like member services, just numbers where you can call, as well as claims information. Just going back to the card too, you might start getting calls from prospects asking you if you're part of the network. So make sure that your staff is aware that starting January 1st, they can, schedule patients that are part of alignment. This is another way for your team to check eligibility. You can self-register for this portal starting January 1st. Here is the link. This is the information that you would need to enroll, or you can also call the number to check eligibility as well. This is just a screenshot of the process to enroll into the self-eligibility portal. Here is the claims information. If you're sending paper claims, this is the address that you would send the claims to. Like I mentioned, is also on the back of the card. You can also submit claims electronically. We use Office Allied as our clearinghouse. This is the submission ID that we use. Here's the customer service phone number if you would like to get set up for that. I included in this slide additional resources, our online provider directory, which once you have access to our Access Express, you will be able to access the directory from there as well. Provider operations manual, there's a lot of good information in there. Authorizations, guidelines, your referral staff should be aware of what requires an authorization and what doesn't. The link to our provider portal where they can self-register, and then the link to Access Express. Here is our contact information. If you have any questions for any of our team members, this is the phone number for myself and my email and Paola. Please reach out to us if you do want to schedule training for Access Express. We are more than welcome, like I said, to meet in person or virtually. And then here are other important phone numbers. Like once you start submitting authorizations, you can either call it in or use our portal system, check on status, and other phone numbers as well. I see a chat. Okay. This is it. We did include an appendix information with additional information on the clinical programs that Dr. Kedensky touched upon. Now I'm going to go ahead and open it up for questions. Feel free to type them in the chat or unmute yourself.
I have a question. We signed a contract through Arizona Care Network. I don't think there was any other contract signed for Alignment Health. Does that mean that we are only in network or contracted if they are an Arizona Care Network provider? Or will that contract mean we can take all, or if it's an Arizona Care Network Aligned plan, or does it mean we can take all Alignment Health?
Johnny, do you want to take that one?
Yeah, so you're right, Candace. Your contract with ACN includes the alignment plan already loaded in there for the ACN network.
So are there members in Arizona who will not be in Arizona Care Network that have alignment?
I can take that one. It's another good question. Yes, we have additional IPA and group contracts in Maricopa and Pima County. An example, in Maricopa County here, we have a contract with AZ Priority Care as well. And then we also have IORA and Village MD. So we do have additional groups, but ACN is by far our largest relationship and our most prominent one throughout the state.
Okay, so we are also in the AZPC, Arizona Priority Care Network. So we should approach them in order to make sure that we're contracted through that network as well, since we're a specialty group and can participate in multiple.
Yeah, you can check with them, or if you want to shoot us an email afterwards, we can double check and make sure your practice is loaded in both groups. We can double check on our side as well.
You can email me, Candace, for that one.
Okay, thank you.
You're welcome. And I see some questions in the chat. Do you know what your current member attribution number is? We won't know our membership until January 1st. And once we see that if there's PCP offices, you know, with attached membership, we will definitely be reaching out to you guys to set you up with AVA, our AVA portal, like Dr. Kadensky talked about. If you haven't been set up with our Access Express, we will definitely be reaching out as well. We want to make sure that you have the tools, you know, to be able to take care of our patients. And then there's another question, are annual wellness visits done every 12 months or once per calendar year? I believe, correct me if I'm wrong, Dan, but I think it's once per calendar year. Or you, Dr. Kadensky?
Yeah, yes, that's correct. Once per calendar year. It's a weird one where they can be done in November and again in January the next year. So it is once per calendar year.
Any other questions?
Will the plan require for the HMOs an insurance approved referral where it needs to go through any kind of portal for insurance approval?
You mean to refer out to specialty?
Yes.
I should actually pull it up right now. Hold on, give me a second. Okay, I'm gonna pull up our authorization guidelines. Can you see my screen?
Yes.
Yes.
So if you can see here, these are all the services that do not require an authorization. So as long as you're referring to a specialist that's in network, the initial and follow-up visits, you don't need an authorization, which is huge. Simple radiology referrals like x-rays, ultrasounds, CT, select CTs and MRIs, as long as you're referring to a network, you don't need a referral. All you need is to give the order to the patient. They could go ahead and schedule their appointment. For any HEDIS related measures like mammograms, colonoscopies, diabetic eye exams, you don't need a referral. You know, a lot of these are, as long as you're using network facilities, you don't need a referral. Preferred Part B, drug subjects to step therapy do not need an authorization. And then if you keep scrolling down, you can see the services that do require an authorization, and it's basically based on place of service. So you can see the places of service are listed here. So if you're referring, for example, for an inpatient hospital stay, you would need to submit a referral for that. And our authorizations, if you submit a standard request, usually CMS gives us 14 days to approve, but we approve within 2 to 3 days. If you submit something as expedited, you know, we have 72 hours, but we usually approve within 24 hours. And then you can just keep scrolling down and you will be able to see, like, for example, there's certain codes for different categories that do require a referral. So they're all listed here. I hope
Great,
that
thank
helps.
you. Yeah,
You're
it's very
welcome.
helpful.
Any other questions? These are great questions, by the way.
Miriam, I saw another one come up on the chat. For
Okay.
HMO plan, does the member change the PCP?
So if the member is attached to the HMO plan, they can change their PCP once a month. The change becomes effective the first of the following month. So the member would just have to call our member services department to request that change. And then they would get a new card in the mail. For the PPO plan, the member does not select a PCP. Anything else?
How soon can we start to register on that alignmenthealthplan.com or the Access Express?
Access Express, go ahead and email me, Tony. I can send you an Excel spreadsheet. Maybe I can share that with Johnny too, and she can send it out to everybody. You can complete, the information for your staff, and we'll go ahead and set it up now. Paola's actually going out now to do training. So once we get that spreadsheet, we can set up a training with your staff, with eligibility, your referral department, whoever you feel needs access to the system.
Okay, sounds good. Thank you.
You're welcome. Any other questions?
Hey, Miriam, this is Jeff, the sales
ahead, Jeff.
guy, the sales guy. I'm assuming you're going to leave our contact information is attached to this presentation.
Yes, it's on the PowerPoint.
Great. Hey, for everybody out there, we love referrals. If you have friends or family members or others that really want to benefit from a high quality, affordable health plan that's one of the fastest growing, most innovative Medicare Advantage plans in the country, please give me a call directly. That's my cell phone number. I'll be happy to refer it to one of our, we only work with the top agents in the market that can really walk them through and do a good needs analysis and determine if the alignment plan is good for them. So we love the referral and the opportunity to talk to any friends or family members or loved ones that you think could benefit from this plan.
Thank you, Jeff. Okay, if there's no other questions, if you think about, another question after this call, please go ahead and email me directly. My email is on the presentation or any of us, and we are here to answer your questions. We're, as Dan mentioned and everybody mentioned, we're all local here. So, phone call away, or we can go to your office if you need us to. But we thank you so much for coming today and attending this presentation. And we look forward to working with you. Have a good day, everybody.
Thank you.
Thank you.
Thank
Thank you, everyone.
Bye.